Hi guys, sorry we had some connectivity issues. That's the thing with Facebook Live, you just gotta do it live. So we were going to the demo portion. We're talking about swaddling today. Sorry about that guys. If you are just joining us again, go ahead and click the heart symbol and let us know that you're here, that you can hear us loud and clear. Like I said, we were having connection issues before. So we're talking about swaddling today and we're gonna move right into that live demo portion. So first video was all about the tips and tricks for swaddling, and now we're gonna move into the demo portion. So I don't know where people were when we were talking, but this is the large blanket that I was speaking of. And so if you've got a bigger baby, you can end up keeping it nice and short. You've got like a 4 or 5 month old and you want to keep it, you want to have a lot of surface area for swaddling. You want to keep the diamond down like this. If you've got a much smaller baby, you can actually bring the swaddle blanket all the way down here. So this is the first type of swaddle. This is kind of that classic swaddle that you see in hospitals. So give us a like if you had your baby swaddled like this in the hospital and you saw the nurses do it. So I'm going to start this way and I'll show you the difference between keeping the diamond here as opposed to here in just a moment. So first thing is when you place baby down, you want to make sure their shoulders are right at the corner where the swaddle ends, right? Where this is kind of tucked down. And so we were talking about baby's arms were up here. If they're kind of holding, younger babies especially often keep their arms up here. You want to just apply a little bit of light pressure and ultimately baby will drop their arms down. Then you can put your finger here and you can pull over kind of towards their belly button. Or maybe towards their hip, and then hold this while you grab the rest of your swaddle blanket, and you actually want to roll baby and tuck this all the way under baby, and then kind of pull like this so that you're getting this nicely tucked, and that's right under baby. So this is now really nice and tight and snug. Again, remember I was saying it's almost impossible to have a swaddle too tight because of the give of the fabric. Now when it comes to the feet, you always have the option to leave the feet just as they are. You could bring it up so baby's completely swaddled, never have anything in baby's face when you're bringing up this bottom portion here. Or you could actually bring this up in between baby's legs and use it that way. So I'll show you this when we move to, I'll show you how that works a little bit better when we move to have the swaddle be a little bit smaller for a smaller baby. So bring this portion up, and again you want to put it by their shoulder but keep it out of their face and tuck it kind of under them. Again, if their arm is up, you're going to kind of hold it. It's good if you can get that bottom portion and their arm tucked in there. But that's not as important as this side. So again, we're going to take this side, bring it down towards the hip, hold it here, grab the rest of your swaddle blanket and kind of come up and around. All right, and so we're around, but then we want to roll baby. Again, pull, you can pull snugly here, pull, and then roll baby. And this is a big enough swaddle blanket that you can actually, and it's a small enough baby that you can tuck this piece around. Now, the weight of the baby is actually holding all of that fabric under there, so the two sides nice and tight. So it's going to be much harder for baby to get themselves out. And then again, you've got your extra piece tucked up here so that it's much more difficult to get baby unswaddled, baby to get themselves unswaddled. So let me again just show you that particular, this is kind of the classic swaddle. To be honest, it's probably one of the more confusing ones that we're going to do today. So but this time I'm going to show you having the angle of the blanket down, right? So I need 2 hands here. So I've just kind of shortened the blanket here, and now we've got the blanket down like this. If you had your baby swaddled in the hospital up like this, go ahead and give us a comment or a heart to let us know that you've seen this swaddle. But let us know, did you actually use this? I think this one is kind of tricky for parents. So let us know if this one was anything that you guys actually used. Again, you want to keep baby shoulders here. Same type of swaddle, but I've just made the blanket a little bit shorter. So now we're going to kind of take over here, down towards the hip, hold, and then bring this other corner around. And then again, roll baby and tuck under, and you can pull like this so that you're getting it nice and tight. Now again, this portion is under baby's weight, so baby cannot get free as easily because their whole body is holding them down onto this piece of swaddle. Again, you can leave the feet free. If we wanted to, we could bring this piece up just like this. So now baby can be, let's say, placed in a swing for their nap or stuff like that. So if baby's older, you can leave it out, or we can do the bottom part up like this for the younger babes. And then again, never put that in the baby's face. We're gonna take this corner, put that corner right there, and then again, wrapping up and around, rolling baby tight, 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 and tucking in if it's a large enough blanket. And again, I can actually probably fit, this is maybe even too loose, but again, we've got a fake baby who's got some cushioning here as opposed to a real baby. So you just need to be able to stick 2 fingers into that swaddle blanket. So tight, tight, tight as possible. And the ways to really get that are on that first step. When you've tucked it under, you're pulling, you're like tucking and pulling and tucking and pulling. And then on this last step, again, you're kind of like really tucking and really pulling as you're pulling over this way, right? And always put the rest of the swaddle under baby so that their weight is holding it. So that was the first type of swaddle. Again, this time I just chose to leave baby's legs free, but you can tuck that up and under as well. This one I think is the most complicated. I guess I just call it the classic swaddle. I don't even know what the name of all the rest of these swaddles are going to be called. So that was probably my bad for not researching the official names. This is another type of swaddle. Now you see I actually don't have it on a diamond shape. I've got it full on just in the regular square shape. This one is the easiest one and one of the favorites of most parents. If you use this one, go ahead and give us a comment. So again, same thing, you're gonna wanna have baby's shoulders placed right up here. And you're going to take one side. I probably should have done this so that the tags weren't right in baby's face, but thankfully this baby won't mind. But if it's your baby, you might want to switch it up. So you take one of these corners, all right? And the same thing, make sure the arms are down for a younger baby. And you can come right over and just tuck this right under. So it's super simple, just one side over. Then you take this other side, same thing, right over. And then the cool part is you've got this bottom part kind of like this. I don't know if you guys can see here, but the bottom portion is just kind of like this. So all we do is bring this up and over, make sure you've got plenty of room for baby's legs to kind of move around. Maybe fold it under, because again, never want a blanket in baby's face for safe sleep, right? Loose swaddles can be a SIDS hazard, and you take one more corner and wrap it around. Make sure baby's weight's on it. Take this second corner, wrap it right around. And this one is probably big enough that I could even, maybe loosely tie it here. But that is how you do this other one. So this one is a very different type of swaddle. I guess I would call it like a square swaddle. Super easy and simple for parents to do because there's not all this complication with how you got the diamond, how big is your diamond, up, down, over, under. This one's one of the kind of the easier ones. So if you use this one, don't forget to let us know that you use this one or that you liked this one. So weigh in on which one is your favorite or which one you think is the easiest to use. Certainly, I think that first swaddle, once you get the hang of it. So again, we're gonna do the second one again, just in a square. We're gonna be folding that first corner over. This is the second corner. We're gonna come right up and over. Again, we're making sure that this is nice and tight so that baby is not going to be able to get out of the swaddle, and put baby's weight on top of the swaddle. Got the bottom corner, and you just fold baby right up and under. And that is that second square swaddle. So the first type of swaddle that I just showed you is actually quite easy once you get the hang of it, but at first it can be really tricky. So this one is often an easy one that parents can learn quite quickly. So that is the second type of swaddle. And then this third type of swaddle is actually one that kind of blows my mind every time I do it. And this one is perfect for older babies who want to have a little bit more wiggle room or ability for baby to kind of loop around. So again, we're gonna start in the diamond shape, and actually it's not quite a diamond shape, it's more, put it in the square shape here, and kind of bring one, I have a baby in my arm, a fake baby in my arms, and I'm trying to do this. So bring one down like this, we'll do it in kind of a diamond. I think if you do it in the square, it works as well, but all right. So then we place baby, again, same thing. The shoulders are up here, right? But we're actually going to take baby's arms and put them under this fold that we made here. So this way, baby has an extra layer of having to keep their arms in, that they have to break free from this and the swaddle in its entirety. So it's really great for your escape artist babies if you wanted to try this one. So again, same kind of diamond shape, but you would put the arm under. If you've got an older baby, you want to put them kind of more in the middle. If you've got a younger baby, you would kind of start more up here and just put their arms this way in the swaddle. And then kind of the same thing as that first one, tuck that first side over. And then the second one, put your arm under like this, arm down by the side, and then take this side right across and make it tight. And then this bottom piece, you can just tie it. So you can take this bottom piece and you just tie it right up like this. So this one, like I said, is probably better for your older babies or your escape artist babies. I'm gonna run through this one more time so that y'all can see. Has anyone heard of this swaddle? Did anyone use this swaddle? I don't think it's terribly common in the US, but I think it's a great tip and trick. So if you have ever used this swaddle, go ahead and give us a heart or leave a comment, or if I just blew your mind with this new type of swaddle, do that as well. And don't forget to share with any friends out there who might need this third type of swaddle for their escape artist baby. So again, we've got it kind of in a awkward diamond, I guess is a better way to put it. I had it initially in a square and I kind of tucked this corner down. So I have a very slippery table apparently. So if you've got an older baby, you're gonna wanna place them here. If you've got a much younger baby, you can actually place them up here. So you don't need as much, because they've got smaller limbs. So put the baby, again, shoulders right here at the edge, tuck that arm under, and then wrap baby. And again, remember that trick from the first one. You can tuck and pull, tuck and pull, tuck and pull. Now we know, look how tight that is by comparison. And then we take the other side, put the arms here. Again, make sure arms by the side. And then same thing, bring this side up and over and make sure it's nice and tight. And then take the bottom portion and just tie it up. So now you've got baby tightly swaddled, but their arms, even if the swaddle breaks a little bit, their arms are still under this blanket. So what about babies who don't like to be swaddled? What do you say then, right? You've got a ton of babies. My baby doesn't like to be swaddled. I've swaddled him up. He or she is still crying. You know, why doesn't baby like to be swaddled? The key is actually for you to add the other S's. So we went through last week kind of an overview of the other S's. And then this week, we're just doing swaddling kind of as a breakout session. But the next few weeks, we're going to be talking about the various other S's. So what are those other S's? Just quickly. So now you've got baby swaddled. One of the other ones is sucking. So either a pacifier or you could put a clean finger into baby's mouth. The other one is, I'm going to scoot this way around the table, is the side or stomach lying. Never while baby's asleep, but you can do this. This turns off their scare reflex. You probably saw me just moving moving a little bit here. That's the swaying piece. So you want to have constant motion. If baby is screaming their head off that they, you know, are just super upset, your motion has to match baby's intensity of their cries. So if baby is just falling asleep, so you want to start out, they're really loud and you're kind of having this nice bounce. You've got their head supported in line with their neck, so there's not going to be any whiplash, there's not going to be any shaken baby. You're just think about running for the bus, right? Even if you're holding baby in a carrier or you've got baby in a stroller or a car seat and you're running to catch the bus, if baby is crying really loud, you want to make sure your motion is very vigorous. And then the last S is a shh, which is as loud as a vacuum cleaner because your womb is as loud as a vacuum cleaner. So baby's cry is about 100 and 110 decibels right in their own ear. And then you've got baby who is who's screaming and that's all they're hearing, but the womb was 80 to 90 decibels. So you need something quick, a loud librarian, a nice shh right in their ear, and you want to be loud at first, and then as baby calms down, you slow that down. So same thing, motion is quick and fast with baby if they're crying really loudly, and then your shh kind of decreases in intensity as baby is better or as stops crying. And so those are the other S's that you can include to really get baby to stop crying. That's why swings work. Tranquilo Mat has both the motion and the sound. You can use white noise machines or a swing, but the Tranquilo Mat has both of those included in it. So that's why I created the product, to make it easy to have that constant motion and constant sound. So that's it for my tips for tricks for swaddling. I'm gonna go ahead and sit back down over here, and we'll go to a question portion. So give us another moment while we change the camera angle, okay? Thanks, guys. Hopefully we don't lose you again this time. All right, I'm moving. All right. Kind of, sort of. There we go. All right. So, can I use a real baby? I could use a real baby, but I don't have one with me today. The baby that is here, this is Erin, is asking if we can use a real baby. We will work that out for another session. We'll put another video together with a real live baby, because I do know that babies move and struggle around, and we'll put that together for you guys separately. But I don't have a baby here that I can swaddle for you. So, or the one that I do is asleep, and he's 11 months and he's taking a nap upstairs. So I'm not going to be one of those people that wakes the baby. We all know better than that. So yeah, so that's kind of the tips and tricks to swaddling. If you guys have any other questions, go ahead and add them in here about the swaddling, even maybe just if you've had issues with your own baby, if you've had trouble, getting your baby swaddled. You can swaddle baby. So one of the questions that just came in is, what age should you start to swaddle? You swaddle baby from 0 all the way up to 6 months. You want to start, once baby starts to be rolling, you want to start leaving one arm or 2 arms out of the swaddle. So if they're rolling in their sleep, they'll be able to move around, when if they roll in their sleep. So you can start swaddling baby from the minute they're born in the hospital, they're swaddled, right? And you can continue that onward until, with both arms down, until they start to roll over. Yeah, so that's a great question. Thank you for chiming in with that. Are there any other questions about swaddles? There are some other products actually on the market as well. So some parents don't. I personally think that the blanket is super easy to be using, especially once you get it right. You always know baby is tight, but a lot of parents are buying those, I guess they're like the Velcro type swaddles. So it's more like a sack, and you put baby in, it's just got these 2 flaps. You can use that as well. I find them challenging because I think babies can escape from them a lot easier. So I really like the blanket. But certainly there are plenty of other products. And if you've got an older baby who's looking if you're looking to kind of keep them in a swaddle type situation, you can either use that last swaddle that I showed you, where the arms, you can kind of put them under the blanket as well, or there are other products that provide kind of like more like a sack, so that it keeps them in, but their arms are still out. So it's like a sleep sack. In particular, there's another company that provides one called Nested Bean that has almost like a weight on their chest. That one can be really great for keeping babies swaddled. You combine that with some of the other S's, and your baby will be fast asleep in no time. The blanket that I used today was a standard 8 1/8 size blanket. So I don't know, probably like 4 feet by 4 feet, I think. That would be my estimate of how big that blanket was. I could actually I'm pretty good with distances. So I would imagine it's about 4 feet or so. I'm 5 feet tall. I don't think I could be swaddled in the blanket at all. It's probably 3.5 feet, I would say, because if I'm 5 feet, my wingspan is 5 feet. And so I would say it's probably about 3.5 feet by 3.5 feet. And it's a nice big square. And it is a cotton muslin blanket that I used today. Are there any other questions out there about swaddling? Did anyone out there use swaddling? Are you still using swaddling? Go ahead and, you know, pop in with any info. Yeah, and next week, I am amiss to remember what I'm talking about, probably because I am so focused on swaddling this week. But next week, we will be tuning in again at noon every Thursday. And we'll be talking about one of the other S's. So it might be side lying, it might be swaying, and it might be sucking. Or shushing. So one of those other 4 S's we'll be talking about next week. Let's see, can you use a swaddle with a Tranquilo Mat? You can actually, that's a great question. So the small size Tranquilo Mat actually can be swaddled up with baby. So you can either put baby on top of the Tranquilo Mat and then swaddle baby up, or you could put the mat on their belly and then swaddle baby up. Again, with the small size, especially if baby's gonna be sleeping, you wanna take into account that the mat is an extra layer. So they might get a little bit warmer than usual. So you might wanna take off a layer of clothing that they're using or wearing. And then certainly you would want to make sure that they're tightly swaddled, because the small size really is too small for a sleep setting unless they're tightly swaddled up with that. And there's no way of the mat escaping and kind of creating an extra hazard, so to speak, or like a pillow type situation in a crib setting. So you can use that. Kaylee, I'm sorry I missed your question. How can you tell if baby is too hot? Anytime a baby is sweating, they're too hot. That is the first thing, because babies don't sweat. That's actually their kind of last defense mechanism. Unlike adults, we start sweating kind of right away to regulate our body temperature. But if a baby is sweating, they are too hot. The other thing that you can test is just to feel the back of their neck, and they should be about the same temperature that you are. So again, good rule of thumb is if you are just if you're wearing, you want to be naked in your house, baby's just in a diaper, swaddle blanket is the one extra layer that baby needs. If baby is hot, they'll be flushed. You'll start to feel the back of their neck. They're really, really warm. You want to take that one extra layer off. That is how you would know if baby's too hot. And again, if a baby is sweating, it's their last defense mechanism, so they are way too hot. Unswaddle them or take off other layers of clothing almost immediately. Certainly if they're sweating as well, it could be that they're sick. So you would want to take an actual temperature in that case, but you could actually overheat baby by adding too many layers of clothing, and any sweating baby is not good. So make sure you kind of cool them off, and you can, again, check the back. It's a lot more indicative than it would be on their forehead, just because their forehead could be a little bit cooler, but the back of their neck is more of an accurate temperature. It's closer to the core, and they probably have clothing there and stuff, so it's going to give you a better read of how baby is if they're too warm. Reports that say swaddling is unsafe. So again, the only way that I would consider swaddling to be unsafe is if it's done incorrectly. So if you've got a blanket that's too loose, it can easily go over baby's face and cause a SIDS hazard. So that would be sudden infant death syndrome. If you've got pillows, stuffed animals, any kind of blankets, any bumpers in the crib, any of that stuff, it could get into baby's face when they're sleeping and they don't wake up and kind of move themselves away from that. So the swaddle that is tight, you want to make sure that you're using that so that it's not any kind of safety hazard. The other thing that you'd want to make sure of, again, we talked about this, it's pretty impossible to make the swaddle too tight, at least around the chest area, as long as you can squeeze 2 fingers in between baby's chest and the swaddle. So that means baby can breathe and they're good. There's no issue with that. And then the other thing that you can keep in mind with safety with swaddles is that train of thought, totally lost it. I just saw somebody else's question come in. I'll grab that in a minute. Okay, so yeah, so we were saying the swaddle, you want to make sure that it's not too tight by sticking the 2 fingers in, and then you would Also make sure that it's not too loose so that you're not having any issues with that. And lastly is making sure the baby is not too hot with the swaddle. The other thing that's a big thing, it's never impossible, it's almost impossible to have baby swaddle too tightly with their arms, but their legs, you don't want to swaddle their legs down or tightly. Babies need to be able to straighten and extend their legs and kind of kick around. If you kind of force a baby's legs to be down, most newborns have their legs kind of up towards their chest. If you end up kind of forcing their legs in a down position or in a straightened position and you're swaddling them up like that, it can actually cause some issues with hips. It can cause hip dysplasias, it can cause some pain and issues with babies' hips. So that bottom portion where their legs are swaddled can be as loose as possible, and you want to make sure that there's plenty of room down there for them to kick around. So that's kind of another safety piece. But other than that, swaddling is perfectly safe. In fact, there are studies that show that babies who are swaddled when they sleep actually are better when it comes to sleeping. They are less likely to have a SIDS incident, where the sudden infant death syndrome. So babies who are swaddled are actually safer in that particular setting. So I don't know who's reading about swaddling unsafe, but you know, as long as it's done properly, it shouldn't be a problem. And then Conita, I hope I said that right, Conita, has asked if the baby is still too hot, if they're sweating from the back of their head, but their feet are very cold. So babies actually have, that's a great question, babies actually have really poor circulation, believe it or not. So most babies who are born, when they're first born, their hands and feet go blue a lot. And parents freak out because they're like, oh my God, my baby's feet are blue, or their hands are blue. So their hearts, when they are in the womb, they have holes in their heart, or two holes. There's a hole between the heart and the artery, and then there's also a hole between the two sides of the heart, because they are getting their oxygen from mom, from the umbilical cord. So they don't need a heart that works kind of like ours. And when they're born, the minute that they start to take that first breath and cry, it's almost like, think about a doggy door. So those doggy doors are kind of loose like this. So that hole in their heart, the pressure of them breathing and crying and the whole thing closes that door. And so that provides the heart in normal sequence like adults do, so that the blood is going into the lungs, getting oxygen, and then going back going back into the heart to be pumped out to the rest of the body. So when that baby's first born and they're breathing and they're crying, that doggy door, that pressure of the breathing and crying is closing that kind of doggy door, right? But when baby is getting a little bit older, or let's say they're sleeping and they're quiet, it's more like this. It's like a little flutter in that particular portion of the heart, and therefore they end up having less, like, there's unoxygenated blood mixing with the oxygenated blood, and that's what's causing the issues with their hands and their feet getting blue. So you end up a baby whose hands and feet are blue, especially in those first few weeks, not a problem. That's just based on those the circulation that baby had in utero. They had those holes in the heart that were more like doggy doors. So they've got, certainly it's going to close, and most babies it closes on their own, but then it will close down when they're breathing. But then occasionally it's kind of like this fluttering open, so they get a mixture of oxygenated and unoxygenated blood, and therefore their hands and feet sometimes still remain blue. So that is very normal. So Konita, don't be worried, as long as your baby is hot on the back of their neck. If they're sweating or they're hot on the back of their neck and their feet are blue, do not worry, do not panic. Again, talk to your pediatrician, but chances are they're going to tell you the exact same thing I just did. Totally normal for new babies. I believe those holes close officially by the first year, but I'd have to check on that. So my apologies for not knowing that off the top of my head. But most babies have that particular issue with modeling in their hands and their feet, so they get a little bit blue. As long as their core is not blue, as long as their chest, their face is pink, and they're warm in the back of their neck, they are happy and healthy. So I think that's it, guys. If there aren't any other questions, I'm going to wait another moment or two for people to throw in any questions. And again, next week, same time, noon time, Eastern Standard Time, we're going to be doing another Facebook Live, and you come with your questions. We're going to be talking about one of the other S's. I still can't remember which one. I've been so focused on talking to you guys and answering your questions. And I can't remember which one it is, but it could be either sucking, it could be shushing, it could be swaying, or it could be side or stomach lying. So we're going to be talking about one of those. We obviously on our Facebook, we give you the info so that you'll know which one we're talking about that particular week, and come with your questions. Tiffany had a question: when babies are newborns, do they still have trouble breathing? So baby who's left the hospital shouldn't have any issues breathing. That they should have been checked on with that at the hospital. Most babies who might have issues where they forget to breathe during, like, how do I put this? They kind of forget to breathe, and then they do turn themselves blue. That usually appears during those first few days in the hospital. Of course, any parent who's worried, there are plenty of products out there, like the Owlet can provide kind of continuous pulse oximetry and let you know that your baby is breathing. But most babies who have any difficulty or issues with breathing, it's caught quite early, especially newborns. Babies' lungs are filled with fluid. They often are filled with amniotic fluid and just that kind of stuff that's in their lungs. And so when they're first born, when they first cry, they're going to have, they're using those bulb syringes, and they're kind of hawking up, I call it like hawking up these gross loogies with phlegm and all this other stuff. And you're using that bulb syringe to get it out right at first. But baby, even for those first few days in the hospital, might have that. And that's totally normal. That would be, just kind of getting out the rest of that mucus from being inside the lungs, the rest of that amniotic fluid from those first few days. But most babies don't have issues breathing. Very rarely do babies have issues where they kind of forget to breathe while they're sleeping. And that's often seen first when they're in the hospital. But certainly if any parents are worried, or let's say you have a history of it in your family, there's a history of SIDS for any reason, or you've had a family member with a history of SIDS and you're super paranoid or worried about that kind of stuff, totally normal. And there's several different devices that you can use. They're quite pricey, but it's definitely that peace of mind knowing that your baby is breathing while you're sleeping. But as long as you have those two fingers in between baby and the swaddle, baby shouldn't have any trouble breathing in the swaddle, and most of the breathing difficulties do clear up or are noticed at least at first in the hospital, and baby would stay in the hospital until that was kind of resolved or figured out. So I wouldn't be too worried about that. Next week, there are no other questions. Next week, we are going to be talking about, I finally found it for you guys. So we are going to be talking about next week, noontime, Eastern Standard Time. We are going to be talking about side or stomach lying. So that's next week's Facebook Live. So come learn all about why we do that. Again, never while sleeping or never while unattended, but we'll be talking about all those tips and tricks. And we'll also be talking about how to combine that with the swaddling, but we'll be doing a full-on breakout of side or stomach lying and different ways to hold baby, to kind of calm them and soothe them, and why we do the side or stomach lying. So I want to thank you guys all, Conita, Tiffany, I believe there was Nicole was earlier. I know we had some people kind of hop in and hop off just because of the connection. I'm sorry that broke up for you guys, but I appreciate everyone tuning in today and checking out swaddling. And I hope that that has been really helpful. If I forgot anything or I didn't answer anyone's questions, you can always PM us, private message us on Facebook, and I'll answer those straight away. Additionally, you can tune in next week and I'll answer any questions that I might have missed this week. So thanks again, guys, for tuning in. Really appreciate it. And I hope I've answered all your questions, and swaddling is now super easy and you know exactly how to do it. And you're going to have a baby who is swaddled really well. So thanks, guys, again for tuning in, and have a great afternoon. Bye.